Welcome to Anupurvi, the clinical discussion program today. Uh, there is one idea behind discussing today is I learnt one medicine from late Dr. G.S. Acharya, Srinivas Acharya from SDM Murthy College. Sir taught me one medicine long back, more than 15 years ago, long back. I want to discuss with that in today's discussion with you all. It is Sura, kshara, kasisam. Sura, kshara, kasisa is a rasa aushadhi. It contains chief three ingredients. One is Surya kshara, potassium nitrate. Second is kasisa, ferrous sulfate, and jambira surasa for bhavana. So, Surakshara Kasisa Prayoga in clinical practice has given a lot of good improvements in many of the patients. So I want to discuss about that. Surakshara Kasisa is a kshara kalpana. The total compound, Surakshara Kasisa compound, it is one of the fast acting drug in Ayurveda. Surya kshara is KNO3, potassium nitrate. It is Katu Ushna Kafavatahara. Surya kshara is Katu Ushna Kafavatahara. So hence it is effective in many of the Apmahabhuta Agni Manda Vikaras. Apmahabhuta Agni Manda Vikaras. When Apmahabhuta is not properly functioning in the srotas or in the body, when water molecule or water ions are not properly metabolized in the body, Shrota develops, Pandu develops. So Surya Kshara originally indicated for Pandu, Hridroga, Grahani. See, nice complex, Pandu, Hridroga, Grahani. One is metabolic disease, another is Trimarmashrita Roga, and another is Pitta Prakopajanya Vyadi. And Surya Kshara is also very good drug for stimulating the Yakrit Pliha. Hepatocytes are activated and hepatocyte stimulant action is there for Surya Kshara. Surya Kshara is Vishagna, so Surakshara Kasisa is also Vishagna. Surya Kshara is Ashmari Bhedana, Ashmari Hara. And Surya Kshara is, even though it is Katu Ushna Kafavatahara, it is Mutra Krichra Nashanam. So Surya Kshara and Surakshara Kasisa have their inclination towards their action on Mutra Vasrotas, Mutra Krichrata, dysuria, anuria, and it is also Surya Kshara is effective in Gulma Nashana, anti-tumor activity is there, and it is Vibandha Nashana. Surya Kshara is also having Saraguna in its nature. Kasisa, all of you know, Kasisa is one of the ferrous fumarate, ferrous sulfate. It is Amla Tikta Kashaya Rasa and Ushnavirya. Basically, Kasisa is Raktaprada, Kandugna, Varanya, Panduhara, Jaragna, Vishagna, and Artava Janaka Pravartakam. Kasisa is effective in Rasavasrotas, Raktavasrotas, Rasadatvagni, Raktadatvagni, Artavagni, and Artavavikaras. Jambira Rasa Bhavana is used, and Jambira is also Amla Rasa Pradhana Dravya, Amla Vargiya Dravya. It is Amlam Ushnam, Deepanam, Pachanam, Saram, Vatanulomanam, Sroto Shodhanam. So, what is the manufacturing methodology, pharmaceutical methodology of Surakshara Kasisa is Shodhita kasisa and Shuddha Surya kshara are mixed together and Jambira Sarasa Bhavana is given and Chakrikas are prepared and that Chakrika is given to Puta. 300 Manotpala Puta is given and check for Samyak Basma Lakshana. If it is not there, again repetition of one or two Basma Putas can be given. So Surakshara Kasisa is um, one of the best drug to be used in Mutra Kruchra Roga Adhikara, Mutrava Roga Adhikara, and also it is very good for Kleda Shoshanam, Apmaha Bhuta Shoshanam. So, Surakshara Kasisa is Lavana Kashaya Rasa, it is Ushnavirya, and Surakshara Kasisa is Mutrala. You will get a quick Mutrala effect. Whenever Mutra Kshaya Lakshanas are there in patients, unless otherwise specified, due to infection or due to autoimmune disease or due to organ failure, be careful that Surakshara Kasisa should not be given in patients of CKD. Otherwise, in all other cases, it can be given. Because if you give Surakshara Kasisa in CKD patient, it may cause hyperkalemia. So, there it is contraindicated. It is Mutrala, it is Shotahara, Sarvanga Shotahara, Pada Shotahara, Karshana. It is one of the important action of Surakshara Kasisa is it is Karshana. So when patient is having water storage in the body, Kleda is more in the body, Ama is in the body, this will do Karshana effect. It is Karshanam, Apatarpanam, Raktavardhakam. And Pandugnam, Shotaharam, Jalodhara Nashanam. Surakshara Kasisa can be prescribed in Jalodhara when patient is having frequent parasurgical removal of the fluid, then Surakshara Kasisa can be given. So it is Shonitaja Kleda Nashakam. It is also effective in uric acid high levels. If we give Surakshara Kasisa in patients of high uric acid level, it will bring down the uric acid level to normalcy. In ascites, it will reduce the water molecule. It will remove the water molecule from the srotas. Actually, Surakshara Kasisa can be best practiced in warts. If you apply this to the warts, it will be having a good result in removal of the wart. It is effective in gouty arthritis. Surakshara Kasisa should be given with Eranda Muladi Kashayam in gouty arthritis. Surakshara Kasisa locally applied with Jamira Rasa over the warts and such growths, or even Surakshara Kasisa can be given where the Dushta Vrana is there. You can do small application of Surakshara Kasisa, dusting upon the Vrana, and then that can be cleansed very easily. Vrana Shodhana effect is there for Surakshara Kasisa. The Kleda and Srava in the Vrana will be absorbed by this Surakshara Kasisam, so then Vrana becomes clean and healing starts. Another interesting thing about Surakshara Kasisa or Surakshara is it is very good for desensitization. Whenever there is a hypersensitivity, then desensitizing effect of Surakshara and Surakshara can be seen. So, Surakshara Kasisa can be used in Dantaharsha, high sensitivity of the teeth for cold and hot. When the sensitivity of the teeth is increased, in the Danta Dhavana Churna, Surakshara Kasisa is added and applied over the Danta, then there will be reduction in hypersensitivity in the teeth. So the teeth hypersensitivity can be treated by Surakshara Kasisam. And actually, Surakshara, potassium nitrate, is more used in fertilizers, plant growth improvements. So many of the fertilizers contain Suraksharam or potassium nitrate, and in human being also, Suraksharam is used in Mutra Visroto Vikaras. Under the ground, the roots of plants will absorb the potassium nitrate and they will grow better, and it is also antimicrobial pesticide. Surakshara is pesticide, it is antimicrobial, anti-hypersensitivity, anti-wart, and anti-ulcer, anti-wound drug it is. So you can use it in variety of kaya chikitsa, shalya tantra, shalakya tantra, charma rogas, and shota pradhana rogas in mutravasotas. Surakshara kasisa, whenever you are prescribing Surakshara kasisa for Pandu patients, Pandu Roga patients should be prescribed with Punarnava Manduram. Punarnava Manduram or Navaya Saloham. Along with Navaya Saloham, Surakshara kasisa can be given. The dose is half rati to 1 rati. Now 125 milligram is very maximum good dose. And Surakshara kasisa should be given with Panduttara Shota cases. Some of the patients will have Nisaraha, Shitilendriyaha, Panduttara Shota. Then also Surakshara kasisa can be given. Surakshara kasisa is prescribed in Jalodhara with Aragyavardhini, Punarnava Mandura, Gomutra Haritaki. In Jalodhara, Gomutra Haritaki Kalpa becomes very important Pradhana Dravya. Along with that, if you add Surakshara Kasisam, there will be improvement in Jalodhara also. In case of cirrhosis of liver, where nodular hardening, decrease in the size of the liver parenchyma, and there is a congestion in the liver arteries and vein, then hepatocyte stimulant effect of Surakshara kasisa can be used, and it will do karshana and lekana of the pitta vasrotas. Pitta vasroto moola will be done. So in cirrhosis, patoladi kashayam should be given as anupana for Surakshara kasisam, or second option is patola katurohinyadi kashayam and Surakshara kasisam can be given. Punarnava Mandura Aragyavardhini Surakshara kasisa can be given in cirrhosis patients. When hypoproteinemia is there, in hypoproteinemia, along with protein-rich diet and salt-restricted diet, Surakshara kasisa can be given. Like in nephrotic syndrome, Varnadi Kashayam, Chandraprabhavati and Surakshara kasisa can be prescribed. In case of nephrotic syndrome, another option is Mutrala Kashayam. Trinapanchamula Kashayam can be prescribed with Surakshara kasisam. In case of pulmonary edema, Pippali Sadhita Kshira and Surakshara kasisa can be given. Firstly, Surakshara kasisa should be administered, then Pippali Kshira Paka should be given in pulmonary edema. Chausat Prahar Pippali Prayoga or Guda Pippali Prayoga can be given, and Gomutra Haritaki is given. Gomutra Haritaki Lepa on the lung field or Dashanga Lepa on the lung field is also effective. In congestive cardiac failure patients, where patient is having more load of venous blood on the heart, in congestive cardiac failure, Talisadi Churna, Pippali Churna, Arjuna Churna and Punarnava Mandura along with Arjuna Aristam can be prescribed in CCF patients. And also Dashamula Katatriyadi Kashayam can be prescribed in CCF along with Surakshara kasisam. In case of left ventricular failure, when left ventricular failure cases are there, Surakshara kasisa with Arjuna Sitopaladi Churna is given. Along with that, Dashamula Panchakoladi Kashayam, Dashamula Haritaki Rasayanam can be prescribed with Brahma Rasayanam. Surakshara kasisa with Brahma Rasayana is also very effective in left ventricular failure patients. In patients of biventricular failure, then Gokshura Kshirapaka, Talisadi Churna, and Gomutra Haridaki and Surakshara kasisa is given. So, in a nutshell, today we have discussed about Surakshara kasisam. Surakshara kasisa contains 3 drugs. One is Suryaksharam, second is Kartisam, and third is Jambira Surasa Bhavanam, and then Puta is given to this and Bhasma is taken out. Surakshara kasisa is Kledahara, Shotahara, mainly Mutrala. It is diuretic and it is decongestant. It is going to reduce the hypersensitivity of nerves and dental problems. So Surakshara is Vishagnam. Surakshara kasisa is a Vishahara Rasakalpa. It is very simple. Any Vaidya can prepare and practice. And whenever there is a Shonitaja Kleda, whenever there is edema, bilateral pedal edema, whenever there is heart renal distress syndrome, we call it as heart renal failure, and then also Surakshara kasisa can be prescribed. Surakshara kasisa will be given very carefully in the low dose, and it should not be given for a longer time. Whenever there is uric acid is raised in the blood, Surakshara kasisa is effective. Whenever there is early nephropathies are there, not with chronic kidney disease established patients, you want to remove the fluid load on the heart and liver and kidneys, then also it can be used. Whenever there is atherosclerotic changes in the arteries, Surakshara kasisam works very well. It is going to cut off the Meda, Kleda and Sroto, Avaroda in the Srotas, and hence it can be used. Whereas in case of hypertensive CKD or diabetic CKD or DKD, Surakshara kasisa should be carefully used. With this, it is not a harmful drug, but it should not be given in high dose or overdose. It should be given in very low dose, at least Ardha Rati to 1 Rati Pramana or dose can be given. But whenever you suspect pedal edema or dependent edema, then Surakshara kasisa should be in your mind. Whenever there is uric acid level, Surakshara kasisa should be in mind. Whenever dental hypersensitivity, Surakshara kasisa should be in mind. Whenever Hrudaya Marma Bigata like CCF, LVF, biventricular failure, in all those cases, Surakshara kasisa can be planned. With this, we come to end of today's discussion. If you have any doubts, we can take 1 or 2 questions. Otherwise, thank you.
Good afternoon. You mentioned that it's used in Dantaharsha. Can you just brief how to use it in Dantaharsha, sir? Whether it is as a rinse or how is it, sir?
No, it should be used with any suitable applicant. You use any Taila or Ghrita, which are used in Dantaroga or oral cavity, that can be used as a applicant. It can be applied with a gel, it can be applied with Taila, or it can be applied with Triflaghrutam. Or even you can use Navanita. Take small amount of Navanita, mix Surakshara kasisa and do gum painting. After 5 or 10 minutes, wash the oral cavity. That will reduce the sensitivity.
Good afternoon, sir. Sir, you told us that Surakshara kasisa is a Kleda hara dravya. So, can we give it in hyperhidrosis? And if we are able to give, how we have to give, sir?
It should be carefully used. Suitable Kvata Anupana or suitable Churna Anupana select as per the Vyadi. When Vyadi Pratanika Aushadhi is there, add Surakshara kasisa along with that. In low dose, start the trial. And once patient's tolerance is good and LFT, RFT are good, you can further proceed.
So, excessive sweating, like for local application also we can give?
Yes, you mix with Sarivadi Churna and give orally Sarivadyasavam. Surakshara kasisa reduces hyperparesthesia. The more sweating in the palmar surface, you can apply with Sariva Churna or Lodra Churna mixed with Surakshara kasisam and apply. And also orally give Surakshara kasisa with Sarivadyasavu Ushirasava. It will reduce the excessive sweating due to more kleda.
Thank you, sir.
Sir, namaste, sir. It has actually kasisa basma already has water molecules, no, sir?
Ferrous sulfate. When
and also, and also like Jambira Swarasa. So again, that is also kleda. So how can we say that it is roop means it karshana? It does it because it increase agni, but yes, sir.
No, you are not following. See, firstly, Jambira Swarasa Bhavana is given, then it is subjected to Puta. When you give it to Buddha, Agni Samskara, it becomes very powerful drug. There it will not have its kleda. Ferrous sulfate, the water content in Jambira Swarasa and all, they will be evaporated. It will be burnt. then it becomes kshara pradhana drug. It will be more kshara.
But what I feel is it has that, I mean, Agni and Jalatattva will be remaining. So otherwise, they would have used some other Ruksha drug, because Kasisa seems to be little with Kleda, means with Jalamahabhuta, not Kleda.
No. Ferrous sulfate, it is when subjected to Putta, Mahabhuta cannot stay in the drug. After subjecting to Putta, there is no Apmahabhuta in that. It will evaporate. Then it becomes very strong drug for...
Sir, what I feel is, if at all, otherwise they would have used Chitraka Kashaya or something, because it can be directly a Ruksha. Why only Jambira Swarasa, sir?
No, it is Shastra, no, we don't know. Shastra Pramana is there. Amla Rasa to the Kshara Rasa and Kashaya Rasa, this combination, Amla Kshara Kashaya Tiktam, this combination they have made for Bhavana, but after giving Putta, water molecule remaining in Kasisa is not possible.
Okay, sir. Thank you.
Sir, one last question.
Yes.
Sir, for Shota, how many days we have to continue?
Since it is Kledahara, Medahara, so can it be used in PCOD also, sir?
Definitely. Very good question. Usually I give 7 days course of Surakshara Kasisam and then check the blood for any impairments or improvements and then continue for 1 more week. Usually I give 2 weeks course. First week 1 week course, then check the blood reports and urine reports, Shotahara effects, and again further you can decide. In PCOD also, because it is a Karshana Rasayana, it is Shotahara Karshana Rasayana, you can give for 7 days after the menstrual cycle. After the 5th day or 6th day, you give it, and even in chocolate cyst, Surakshara Kasisa can be given. In patients of ovarian cyst, chocolate cyst, it is very good drug. Along with regular your Pradhana prescription, it can be used. So,
what could be the Anupana for PCOS, sir?
you give Dashamula Kashayam is enough. You can give Dashamula Kashayam or whatever regularly you are giving, Granthi Bedana Dravyas you are giving, along Varanadi Kashayam, Dashamula Kashayam, Sukumara Kashayam can be the better Anupana for Surakshara Kasisa and PCOD.
Sir, as it is Kledahara, can it be given in diabetes?
How it apply on ulcer, sir?
No, when in ulcer there are Kleda and you want to remove the slough from the ulcer or wound, it can be sprinkled and then clean the wound. It will become very fresh. The Lekhana Karshana of the wound slough material, for that purpose Surakshara can be used. And internally Surakshara Kasisa, when you give it to the patient of ulcer, not internal ulcers, gastric ulcer or peptic ulcer, not that. When skin ulcers are there, wounds are there, you can give it internally also, so that the Sroto Roda will be removed and the fresh blood will be gushing to the site of the rana or ulcer and healing starts. In that way you can use.
Sir, is it available in any companies?
It is available. Some of the South Indian companies manufacture it. And some of the Rasavaidyas, they prepare and give it, usually.
Okay. Thank you, sir. Which pharmacy?
work ಆಗುತ್ತೆ ಸರ್.
I use from Emis company also.
Okay. Thank you, sir.
What another question was?
ಸರ್ ಪ್ರಮೇಯ ಪೀಡಕದಲ್ಲಿ ಇದು ವರ್ಕ್ ಆಗುತ್ತಾ?
Yes, it can be used in Prameha Padika. It can be given along with your Prameha Hara Chikitsa. Internally it can be given. So let us finish.
Sir, just a minute, sir. Means just this. I was having this doubt, sir. Like prameha means Jambira Swarasa. Will it increase kleda or will it reduce, sir?
When you are giving Jambira Swarasa in Swarasa form, it is Amlam Ushnam. It is Ushnavigya drug. Amlam Ushnam. But in Surakshara Kasisa, there is no Jambira Swarasa remaining after Puta. Once any Puta is given, Jambira Swarasa form is not there. It is converted into Puta and Basma.
Okay. Means what does it change in the drug actually, sir? Means
Jambira Swarasa acts on KNO3 plus this is acid, and then it will burn in the Puta and it will do samskara upon kasisa as well as Surakshara and goes. So
means Ushna Guna increases or like
Increases,
I wanted to know what
increases.
change it can.
It will be having more penetration effect. It will have more Srotogamitva effect. It will have more Prashana effect.
Okay. Thank you,
So
sir.
when it is subjected to Puta, Jambira Swarasa will convert into kshara, sir.
What?
Any materials which is in raw form, that will convert into kshara, sir. So
Yes.
even that is why sir is telling, Srinivas sir is telling that is having more penetration action. That is whatever residue we
Okay.
get these herbal plants now, sir. End of the product will be when it is subjected to Puta, it will convert into kshara property, sir. That is the main thing.
Okay, ma'am. Thank you.
Kariyappa. Okay. So we'll conclude. Thank you.
Thank you, sir.
Thank you, sir. Thank
Thank
you.
you so much.